Dear students, today we will learn a new chapter in hospital and clinical pharmacy, and the name is hospital. So let's start. Firstly, we will see the learning outcomes of our chapter. After studying this chapter, the learners or the students will be able to define hospital, explain functions of hospital, give classification of hospital, explain organization of hospital, explain health delivery system of India. So students, we will make two parts of these learning outcomes. In the first video, we will see the first three learning outcomes. These are definition of hospital or define hospital, explain functions of hospital, or give classification of hospital. So we will start from definition of hospital. So students, what do you know about hospital? What is mean by hospital? So hospital is a very complex organization with a specific aim of restoration and maintenance of good health. It provides special facilities like nursing, dietary, blood banking, patient counseling, and skilled personnel and team of physicians and surgeons for the patient care. So let's see the definition of hospital. Hospital is defined as an institution that provides community health where diagnosis, therapy, rehabilitation, training, and social services are provided. What is meant by hospital? Hospital is an institution that provides community health where diagnosis, therapy, rehabilitation, training, and social services are provided. So now we will see the functions of hospital. In the functions of hospital, the hospital should perform these 8 functions. In this, first one is patient care, educational training, then counseling and advice to the patient, then medical research, then immunization, then coordination, then rehabilitation, and last one is workshops and seminars. So we will see the one by one. First one is the patient care. It includes services for diagnosis, prophylaxis, and treatment of diseases to the patients. The inpatient services are equally important by providing hospitalization facility. Okay. Second one is educational training. In this facility, This facility is particularly for medical students, pharmacists, nursing or medical technologists, and allied health professionals to fulfill their curriculum requirement. The next function is counseling and advice to the patient. It is a modern concept adopted in big hospitals for their well-being of the patients. During these counseling sessions, pharmacists educate people on communicable diseases, epidemics, and family welfare. The next function is medical research. This should be a vital function of hospital to contribute to the advancement of medical knowledge against diseases and improvement of hospital services in order to render better patient care. This includes devising new diagnostic procedures and techniques. The next is immunization. In the immunization, it helps to prevent the disease. A small unit is run in an OPD section where children are immunized by giving different vaccines like BCG, hepatitis, and smallpox. Now the next function is coordination. Especially hospitals that run under the control of the government act as interlinks between the health policies and the general public. The district hospitals deal with urban and primary health centers. Then next one is rehabilitation, and this facility is provided to drug addicts, chronic alcoholics, and psychiatric patients by specific therapy and supportive measures like yoga and advice. And the last function of hospital is workshops and seminars. Such activity is arranged periodically at state level conference or in hospitals to furnish the details of recent studies. So all these are the functions of hospital, and the question will arise, give the functions of hospital or give the functions of modern hospital. Now we will move towards classification of hospital. Basically, hospitals are classified into two different criterias. The first one is clinical oriented and the second one is non-clinical oriented. So we will see one by one, that is clinical oriented hospitals and non-clinical oriented hospitals. In the clinical oriented hospitals, the hospitals are again subdivided into 5 categories, and under the non-clinical oriented hospitals, the hospitals are again subdivided into 4 subcategories. So we will see the clinical oriented hospitals. The first one is hospitals on the basis of type of medicine used to cure the disease. Second one is hospitals on the basis of anatomy and physiology. Third one is hospitals on the basis of type of patient. Then fourth one is hospitals on the basis of type of disease. Then fifth one is hospitals on the basis of type of objectives. Okay, and under the non-clinical oriented hospitals, there are again 4 subtypes. The first one is hospitals on the basis of ownership and control. Then second one is hospitals on the basis of cost. Then third one is hospitals on the basis of bed size. And fourth one is hospitals on the basis of length of stay. Okay. So all this classification we will see one by one, the one each class and their examples. So first one is clinical oriented hospitals. These are again further classified on a different basis. And the first one is hospitals on the basis of type of medicine used to cure the disease. And the examples are allopathic hospitals, Ayurvedic hospitals, and homeopathic hospitals. The second is hospitals on the basis of anatomy and physiology. And the examples are ENT hospital, that means ear, nose, throat hospital, or eye hospital, or cardiac center, or orthopedic hospitals. The third one is hospitals on the basis of type of patient. And the examples are general hospital, pediatric hospital, gynecology and maternity hospital, rehabilitation centers or accident hospitals. And the fourth one is hospitals on the basis of type of disease. And the examples are cancer hospital, leprosy hospital, or TB hospital. And the last one is on the basis of type of objectives. Under this category there are again two types: general hospitals and special hospitals. The examples of general hospitals are PHC or municipality hospital, and the examples of special hospitals are cancer, TB, or dental hospitals. So now we will see the another category is hospitals on the basis of non-clinical oriented hospitals. Okay, in that first one is ownership and control basis. Under this there are again subcategories, and the first one is controlled hospitals controlled by central government. And the examples are All India Institute of Medical Science, New Delhi, and railway hospitals. The second is hospitals controlled by state government, and the examples are civil hospital, cottage hospital, and PHC. The next, hospitals controlled by corporation or municipality, and the examples are BMC hospital, KEM hospital, and Bhagavati hospital. And the second is, or the next is hospitals, private trust hospitals, and the examples are Jaslok hospital and Bombay hospital. The next is hospitals run by religious body, and the examples are Hindu Machine Hospital, which is located at Chennai, Meenakshi Machine Hospital, which is located at Madurai, and Christian Medical College Hospital, which is located at Vellore. And the next is hospitals or public limited company hospitals. Examples are Walkout Hospital, Apollo Hospital, and Medinovo Hospital. And the last one is private clinics. In these private clinics, such clinics are owned by an individual doctor or a group of doctors in towns or big cities and serve for 24 hours. Okay. Now we will see the next category, that is hospitals on the basis of cost. In this, first one is costly hospitals, and examples is Bridge Candy Hospital or Jaslok Hospital. Then next is low budget hospitals, and the examples are civil hospital or corporation hospital. And the next one is free or conventional cost hospitals, and the example is Manilal Kantilal Hospital, Ahmedabad. The another category is hospitals on the basis of bed size, and in this the subcategories are: the first one is large hospitals. Under this the bed size is more than 1000. Examples: JJ and KEM Hospital. Second is medium hospitals. The bed size is in between 500 to 1000, and the example Jaslock and Bombay Hospital. Now the next is small hospitals. Under this the bed size is in between 100 to 500. So example Bridge Candy Hospital. And the last category is very small hospital. Under this the bed size is less than 100. Example municipal hospitals and private clinics. Municipal hospitals and private clinics. The fourth category is on the basis of length of stay. Under this there are two subcategories: short-term hospitals and long-term hospitals. In the short-term hospitals, the length of stay in hospital is less than 30 days, and in the long-term hospitals the length of stay of patient in this hospital is more than 30 days. So in this video we have seen a definition of hospital, functions of hospital, and classification of hospitals. Thank you. The remaining part we will see in the next video. Thank you.